very big factor in these heart attacks or cardiac deterioration is pollution. India has become a capital for lung cancer.
But when should someone take all these symptoms seriously?
So it's a non-smoker lung from a polluted area, and it's a non-smoker lung from a non-polluted area. You sit straight and you take a deep breath. If smoking is walking towards death, vaping is running towards death.
And then can pollution also trigger asthma or allergies even in people who didn't have these conditions before?
Yeah. So vaping is an industry which is completely unregulated. What kind of ethers, what kind of chemicals they are using, we don't know. You are smoking at one end and pollution on the other end. So it's a double-edged sword which you are taking inside. I've already told in most of my shows that air purifiers are not solution to air pollution.
Hello and welcome to India TV. I am Shivangi and you are watching HealthDNA. Well, our lungs are working harder than ever, especially in cities like Delhi, where air pollution has become a daily challenge. Invisible particles, vehicle fumes and seasonal smog are constantly putting our respiratory system to the test. And many of us feel fine on the outside, but our lungs could be silently struggling. So today we are taking a closer look at how pollution affects lung health, what warning signs to watch for and practical ways to protect ourselves and our families. And to guide us through this, we have with us Dr Harsh Vardhan Puri, chest surgeon from Medanta Hospital. Sir, welcome to India TV.
Thank you.
Now, as I said, pollution. It is grabbing headlines in Delhi. I want you to explain it to our viewers how dangerous it can be for our lungs, for our respiratory system, because I guess many people are now not taking it that seriously.
Yep. So, the first question you are asking to a chest surgeon is concerning pollution. So, I guess we have already reached that mark that it's very, very dangerous, very important. I guess in the morning headlines I was reading that Mr. Nitin Gadkari gave a that whenever I come into Delhi and stay here for 2-3 days, I get these allergic reactions and everything.
In fact, we recently saw Putin came and he was coughing.
He was coughing.
Many celebs do not want to come to Delhi because
Definitely.
they feel that they will be exposed to pollution and that they cannot risk their health.
So I don't want to put Delhi into the limelight because it's already into so much limelight because of the political clout and all those things. But see, some people think that this is a problem of Delhi only. It's not. Few days back I was in Kanpur and the AQI was somewhat like 500 there. So and you see the list of 20 most polluted cities in the world by WHO, and Delhi is, I guess, 6th or 7th in that list, and we have 3 or 4 cities from North India, maybe Ghaziabad or Kanpur and all those above it. So if people want to tag Delhi as the pollution capital,
because it's the national capital, so people often connect
this
with
is
it.
more like I asked the previous anchor also, what do you think Srinagar is? Is it polluted or is it non-polluted?
Well, we feel, being in Delhi, that it is not polluted.
Not polluted. So average AQI in Srinagar at any moment of time these days is 130, 140, and the highest correspondent put a few days back was 400, which is much worse than the normal WHO standard, which is 50. Right. So 50 is also a higher standard, but okay, let's take it the cutoff as 50 for India. But even Srinagar is not spared from this pollution. So it's not a Delhi problem. It's a North India concentrated problem mainly, and a pan-India problem if you think it as, if we think ourselves as a single country. So why Delhi comes into the limelight? It's what I call it as a pollution festival. This October from Feb, most of we doctors which are closely related to lungs, maybe pulmonologists, thoracic surgeons, we call to different shows. Patients ask us a lot of questions, and the concern of everybody is that if we are living in Delhi, our lungs are getting affected. So it's not like that. It's a countrywide problem. It's not the problem of these 4 or 5 particular months. The pollution is there in July also. It's like that if what happens in January or December is then that you open your window and you can't see the opposite building. The people think the pollution aa gaya, pollution
it gets mixed with
it's mixed with a lot of fog and all those stuff, and lot of political pressures, and
let's keep the
politics out of it. Yes.
Aside.
So 2 questions. Is it a Delhi problem? No, it's a pan-India problem. And is it a problem of October to February? No, it's a pan-air problem. It starts from January, it ends at in December. It doesn't end, it continues through December. The situation in last 4-5 years is getting worse because of the vehicular pollution we have added, because of the industry, the urbanization, the movement of people, the more of geographical stature of Delhi, because we are in the center. There is lot of air which is coming into Delhi and not moving out of Delhi at a particular time. So we are the worst hit. And a very some people ask me that I'm completely healthy.
Yeah, people do not feel
that they are. So let's do a simple test just to test the lung capacity. And, this test I'll tell every viewer of yours to do. So if you have a stopwatch or something like that.
Yeah, I have a stopwatch. So we are doing a live test.
Sure.
Okay.
So what you have to do, first of all, you have to sit very straight. This is also very important. If we sit straight, we are increasing our lung capacity by 20%.
Okay.
If we are stooping like this, seeing the mobile, we are reducing our lung capacity by 20%. So sit straight. You are in an office, you are taking an interview, or you are just finished your job. You sit straight and you take a deep breath. And stop your breath.
So I'll have to start the watch.
Yes.
Or after taking the
deep breath.
You should handle that.
So let's see.
Huh. So should I take a breath?
Sit straight.
Okay.
Sit straight and you take a deep breath and stop. Start the watch. So 45 seconds, you've done it.
So 45 seconds is like the average.
Is like the average.
I'm on the average borderline.
So average is in between 40 to 45 seconds.
Okay.
You sit straight, you take a deep breath. If you are able to stop your breath for 45 to 45 seconds, your lungs are okay, healthy.
Okay.
Don't try to do it for 1 minute, 2 minutes. It's not a competition, it's an exercise.
Yeah.
And if you do it 4 times a day, morning, afternoon, evening and night, your lung capacity will increase by 10 to 15% in next 6 months.
Okay, so this is like an exercise as well.
Very simple exercise to test your lung capacity as well as to improve your lung capacity.
Yeah, that's nice.
So people ask me solutions to pollution. I put it in one of the columns where I have to tell the solution for pollution. So see, what is happening in Delhi or the pan India is the problem of you must be hearing these lot of words like AQI, PM 2.5. AQI is a mixture of many of these particles, PM 2.5, the sulfur oxide, dioxides, lot of gases, PM 2, PM 2.5, 10 and 1. And WHO has formed a standard that if it is less than 50, it's pure. If it's above 100, it's polluted, and if it's above 200, 300, it's highly polluted.
Yeah.
So you can measure what you are living in. One thing is that, and other thing is you must be hearing lot of these words, PM 2.5.
PM 2.5.
And what our hair measures is around 70 microns. So PM 2.5 is 2.5 microns, PM 1 is 1 micron, PM 10 is 10 microns.
Very fine
particles which we inhale. So how many times we take? We take breath around 25,000 times per day, and 10,000 liters of air goes inside our lungs and comes out of our lungs. So whenever we are taking this gush of air inside with each breath, we are taking this particulate matters also. What these particulate matter do? This PM 10 goes down into your nose and your throat and your respiratory tract and causes this allergic reactions, coughing, which Mr. Gadgari was talking about, and most of your staff, us, are coughing.
Yeah.
Okay. So this is PM 10. The PM 2.5 crosses the lung and blood barrier and goes to the different organs of the body, gets deposited and causes all the problems.
So it also causes long-term effects.
Long-term effects. And PM 1, the worst of it, or lesser particles less than 1, they cross the blood-brain barrier, enter the brain. They cross the blood placental barrier, where placenta is a cord between the unborn baby and the mother, through which she provides nutrition to the unborn baby. So there was a test which was done where umbilical blood samples were taken, and around 276 pollutants were found inside the umbilical cord sample of an unborn baby or the recently born baby. So this is what we have gifted to our children. Now people ask me a lot of questions like you ask, does it affect the lungs only? No, it's not like that. This PM 2.5 gets deposited or gets mixed with different organs of our body. You are seeing there is a steep rise in these myocardial infarctions or heart attacks in recent days in healthy individuals, people who are gymming, people who are running on roads. So a very
that at a very young age as well.
Young age. So a very big factor in these heart attacks or cardiac deterioration is pollution. The hair fall is happening, one of the causes air pollution. Obesity is happening, one of the causes air pollution.
Okay.
Worst thing, lung cancer. India has become a capital for lung cancer. When actually I'm a thoracic surgeon, I'm trained by one of the top thoracic surgeons of the country, Dr. Arvind, who was head in AIIMS. So when he started doing lung cancer surgeries in 80s, the specific picture of a patient was a 60 plus male with 30-40 years of smoking as a history, and that's it. These days we are seeing young females, 20-25-year-old females sitting in our OPD chambers talking to us about their profiles, and when we investigated them, we found them to be having stage 3 or stage 4 lung cancer. So the only question that lady I remember asked me, neither I smoked a single cigarette, neither my father smoked a single cigarette, how am I getting this lung cancer? And it's very, very difficult, it's very painful, Shivani, to answer those ladies, because the whole dramatics of lung cancer have changed. We never used to find female lung cancer patients in 80s, 90s. Now it is almost 50-50, 50%
that to non-smokers.
Non-smokers. They haven't touched cigarette anyway, anytime. So when we were reading about it, we have a lung care foundation also, which specifically deals with pollution kind of things and awareness of it. So when we were reading, we found a conversion factor. The conversion factor is if the pollution level goes up by 22.5 microns, 2.5, then you have already taken one cigarette that day. So if you divide the normal AQI of Delhi, which is around 250 at a particular time, so you still, from the morning, you have already smoked around 4 to 5 cigarettes. Even without touching that cigarette, you have smoked. So it is not for me and you. Yeah. Now what we have caused to ourselves, what we are dying, we are not dying, is okay. The small child who is born in the morning in Safdarjung Hospital or Medanta Hospital, through the day, if the AQI is 250 or the PM 2.5 is 250, till evening, he has taken 10 cigarettes.
A newborn baby.
A newborn baby.
And exactly, also I wanted to ask, how vulnerable are they? Especially newborn babies, then children and elderly.
3 most vulnerable group, which we release a lot of advisories for. We because we have a repository of around 12,000 patients. So what advisories goes from Medanta to these patients? 3 most vulnerable group. One is small children, because their height is less and their breathing capacity is more. So they are taking a lot of that dirty air inside. The second are elderly, because their lung capacity is already reduced because of the air pollution and age, and the pollution is causing a havoc on this. And patients who have already undergone some procedure or are already having COPD, ILDs, these fibrotic lungs and all those stuff. These are the patients, these are the people who should be cautioned about the ill effects of air pollution the most.
They need to be taken care of a lot.
Yes. So what advisories goes into our daily is that they should stay inside the houses at this particular time of the year. They should not indulge in these heavy activities like running or yoga in open areas.
In closed spaces.
In closed spaces. These schools should stop all the programs and everything at the moment, open air programs. And the patients must stay inside with a good air purifier. Now, people will ask, I'm endorsing air purifiers? Not at all. I've already told in most of my shows that air purifiers are not solution to air pollution. They are a private solution to a very public problem.
People often, consider it as a marketing gimmick.
Yeah.
So is it that or not?
Both way. I tell you how. For this vulnerable group, it's very important. Why? Because now, as you already know that when we smoke cigarettes and we take this dirty air inside, it's almost equivalent.
Yeah.
The number of carcinogens are around 70-75 in both the things. So it is the length of the exposure which will define how many diseases you will get. So if we can cut that length of exposure somehow, the number of diseases and the lung capacity reduction, the toxins in our lungs will reduce definitely. So by putting a good air purifier during the night, closing all the whole room will benefit these vulnerable groups like children, elderly, the auditory lung patients. So it's only going to improve their lung capacity or keep it at a plateau.
Yeah.
But whenever you open the window of that room or the darwaza of that room, the door of that room, the outside air is going to come in and cause the same problem, which is I just advise that during the night time, these people should be taking air purifiers. But yes, what kind of air purifier? There should be good capacity air purifier according to the cubic meter of your room. They should be checked every 2 to 3 months as service is required, and every 4 to 5 months or 6 months the HEPA filter has to be changed.
There are several air purifiers which have heaters inbuilt in themselves.
No.
Do they work or not?
It's not necessary. You should have a very good HEPA filter inside the air purifier. That's all you need for air purifier to work. And you have to calculate the capacity of your room and how many this studio of yours, it needs around 5 to 6 air purifiers to nullify the ill effects of air pollution at the moment. So how many people can afford that kind of money?
That is also
in India? It's a big question. So whenever I advise air purifiers for these people. But for the general public, now a traffic havaldar standing in between the road, managing the traffic, what this air purifier is going to do for him? Nothing. He's going to have these kind of lung problems in next 5 to 10 years. So they are important for a very specified section, obviously. But if anybody asks me to endorse it as a solution to air pollution, not at all. This would be the same kind of dhokhabazi we did with pure water, which was supplied to us in a very pure, free form. Whenever we wanted to drink, we used to open the tap and used to drink water 20 years back. That's not the situation. It's packaged drinking water. Now, how many people will afford a packaged air? There was a in Saket, somebody opened a club. I don't know. I just read it that they were charging 400 rupees for 10 minutes for you to enter that club and take pure air.
Fresh air.
So 400 meters into 10 minutes into a lifetime. It would be something like 84,000 crore rupees. How many people will afford that money in India? So these are all gimmicks. But yes, for some vulnerable population, yes, it has to be.
So if you have, elderly or young children at your home,
or somebody who is already affected by lung disease, definitely you should.
Definitely you should have an air purifier. But so moving on to the symptoms, what are those early symptoms that are warning signs that people often ignore, but it shows that there is a lung damage that needs to be taken care of?
So reducing lung capacity, like I've told, if your capacity is 40-45 seconds today and 1 week later it goes down to 20-25 seconds, alarm should be raised in your mind. The other thing is chronic cough, more than 10 to 14 days, should be evaluated. It can be a seasonal kind of a thing also, allergic kind of thing also, pre-asthmatic status also.
Yeah, people often consider it like,
normal.
They should
it's normal.
Yeah, it's normal and
so
all.
Definitely they should consult a physician. And third thing, if you develop reduction in lung capacity, like if you have your house at 2nd floor and you just very easily run to your house in one day, and one fine day your capacity is reduced, you start huffing and puffing on the 1st floor, definitely something has happened and you should consult your physician. The other point which most of the people ignore is hemoptysis, which is blood in the phlegm in the morning. If it starts happening, it's very dangerous. Immediately go to your physician friend and ask him what kind of investigations I should get, or should I consult a pulmonologist or the thoracic surgeon ASAP. So your body will tell you the changes, but in India actually we don't have time for health.
People ignore,
we don't have time for health, we don't have money for health. We have money for movies, we have money for our marriages,
we have money for shopping and
everything,
all. Yeah, exactly.
But no funds for health, no funds. So
we tend to keep it at later we'll
जब बीमार होंगे तब देखेंगे. So
exactly, that's the strategy. Like for example, there is persistent coughing, there is shortness of breath or chest tightness, and people do not consider it as important symptoms.
And particularly I have seen it with females.
Yeah, exactly. Our mothers do not go to the hospital directly.
Never. They won't even tell you that they are having this tightness in the chest.
I have this situation with my mom as well. So she's like, this is very normal, होता रहता है, pollution है, this है, मतलब बहुत सारी चीजें हैं, it's fine. But when should someone take all these symptoms seriously, like persistent cough and all that?
anything more than 2 weeks.
Okay, 2 weeks is
Yes,
the
cut off,
deadline or
cut
the
off. Yes,
timeline
if
for
it is
that.
happening seasonal, okay, you can perceive it to the air pollution change of the place and all those stuff. But if it's happening more than 4 weeks, 2 weeks,
2 weeks.
definitely you should go to a physician.
Okay, and then can pollution also trigger asthma or allergies even in people who didn't have these conditions before?
Yeah. Under the aegis of Lung Care Foundation, one fine day we thought we have to give a study to the Indian population, considering Indian population as a cohort. So what we did was we took 1,000 students of Delhi and 1,000 students of some remote place like Kottayam and compared their PFT levels. So when we saw the results, they were shocking. In Delhi, around 30 to 33% of the normal children, I'm not talking patients, normal children going to school with normal bag, normal activities, everything were borderline asthmatics. Their PFT levels, technical levels were falling into the slot of borderline asthmatics. Their parents were not knowing it, they themselves were not knowing it, but because they were normal playing students. So these asthmatics will turn into a proper asthmatic, and why wouldn't they turn into a lung cancer patient 20-25 years down the lane, you tell me? Because your lung is changing every day with this pollution. I just want to show you a fine photograph. Actually, I'm a lung surgeon, so I operate upon lot of lungs. Bhagwan na kare kisi ko lung dekhna pade, but I see it daily. So this is a live picture of lungs taken during surgeries. So you have two pictures here. One is on the right side and one on the left side. And I tell you, this is same age group patients. One patient is from a place where AQI is below 50 or 50, 60, and one is from a metro like 300, 200, 300, 400,
so this
500.
is not of someone who
It's a non-smoker's lung. So it's a non-smoker lung from a polluted area, and it's a non-smoker lung from a non-polluted area.
So this is what damage pollution can
This
do.
is the damage which a pollution can cause. Both have some kind of lung disease, but you can see the pure lung which the God has given us, pink, good lungs, healthy lungs, and black, tart lungs which we have created. This is our creation. This is God's creation.
But is this creation of ours, is this reversible?
Okay. Not to some extent, but yes and no both. See, if you ask specific diseases like lung cancer, COPDs, yes. If you stop exposure of polluting particles and smoking, slightly reversibility will start in few months or few years, and the incidence of lung cancer will decrease in that patient. But if you will say that it will dramatically change, no. If you have spoken for around 20 years, it's very unlikely things are going to change now for your lungs, because you are smoking at one end and pollution on the other end. So it's a double-edged sword which you are taking inside. So nonetheless, the smoking should be stopped the day you find this picture in India TV's podcast.
But sir, as we are talking about pollution and in Delhi, while living in a city like Delhi, what are the 2 or 3 habits that we should have, or we should use it in our daily lifestyle, because we do not know how to protect ourselves. Pollution is harming us like anything, and we are breathing polluted air. So what are those 2-3 habits that we should bring into our lifestyle?
So definitely few things have to be changed. The first thing is that you consider pollution as the warrior and your lungs as your protectors. So you have 2 protectors with you. So you have to increase the capacity of your protectors. So what exercise I have told in the very beginning, 40 to 45 seconds 4 times a day should be done. The other thing which is a gift of India to the community, to the world, is yoga. So pranayama, these deep breathing exercises during yoga poses, lot of this power yoga, multi yoga, this all should be incorporated into our lives. It is one of the best things what Indian civilization has given to the world. The other thing is hydration, very important. If you keep yourself well hydrated, all your cells are working on hydration principle only. So you have to take around 3 to 4 liters of fluid per day if your doctor hasn't advised on the contrary, and balanced diet. By balanced diet, what I mean is just stop eating junk. just stop taking empty calories, sugars, brownies, and all those stuff. They are not. They may feel tasty, but they are killing your body from inside. Because see, carbs are needed for our functioning, but they are in proportions.
Yeah,
it
you
is
need to look at the
10% of
proportion.
fat, 30-40% of carbohydrates, 30 to 40% of protein. So you have to divide. You go to apps, they will do it for
Yeah.
you. They do it for you. So you divide your portions like that. Like take lot of salads, lot of fluids, green leafy vegetables, seasonal fruits. Everything should be taken in proportion, and avoid these junks like burgers, pizzas, cold drinks, chips. Everything is high on salt and high on sugar. It's killing your body like anything. So one of the major causes, I told you, of obesity. India is becoming the obesity capital of the world.
Yeah,
Two
increasing
major
cases.
causes: junk food and pollution. So we are in the center of both. So
Yeah,
how can't we become
This
the
is like
number
a
one?
health emergency.
Everything is health emergency. This pollution is a health emergency. Our food is health emergency. So whenever people like you, people like us are telling the world, it's not. I don't know where it's going. It's going to the deaf ears.
No, but people are going
Should
to
listen.
view and
Should
people are
listen.
going to listen. But as we were discussing, as soon as we step outside our homes,
Yeah.
we tend to use masks.
Yep.
What mistakes people often do with
Actually,
their masks?
masks are of three types. One, we take a handkerchief and we tie it. That cloth mask is also very similar. The other mask is a surgical mask which I use during surgery, which is that blue color mask. You must be seeing a lot of those around. Both of these only save you from droplet infections. What are droplet infections? Like tuberculosis, these
Okay.
seasonal viral infections. They can save you from these. They don't do anything to the pollution.
Oh.
Because the polluting air is going to enter, the PM 2.510 is going to enter your respiratory tract without or with this mask. So it's not causing it. What masks help in pollution are at N95 and above. These masks have a very specific thing. They should be of WHO standard first. It should not be from some Tom, Dick and Harry company. The other thing is that they should be properly worn with your nose completely stapling inside that mask, and they should be changed at least after 8 hours.
After
They
8
have
hours.
to be. So how many people in the world, in India, can wear this mask around 12 to 15 hours? How many can afford them? It's a 250 300 rupees mask. And you remember that COVID era?
Yeah.
Were you able to wear that mask more than 1 hour, 2 hour? No, it's not possible. People start running with this mask, and I have seen people developing CO2 retention, fainting with these masks, running with this mask. So it's very difficult.
They feel that it will help them
So again, it's a
prevent the damage from air pollution, but they're also doing the exercise and everything.
not recommended, not
Okay.
at all recommended. So what should be done? These are masks are again recommended for the children, for the elderly, and for the lung patients when they are out there passing through a polluted area, are going to be in polluted area for 2-3 hours. Then they can wear it, but they have to follow the specifications. But for a normal wearing, it's not at all recommended. It's not going to help.
But sir, what AQI level should outdoor exercises be completely avoided? Is there any
300
particular
plus
AQI?
is, my God, it's too high. It's too high. So I don't know what advisory I should be giving, but 250, 300 is very high. Should be stopped.
Okay, and working out in the morning, generally elderly people and many
Similar.
people go out and
It should be avoided.
for walks
It
in
should
park.
be avoided. 100%
completely.
avoided. At this time, no park
Is
walks.
there any window for that when they can go outside and
100,
take a stroll?
150 is becoming a normal for us. So at least let it reduce to 100, 150, and then with all the precautions, do it. But 300, my God, that's too high.
Okay. So now moving on to the protection and treatment, and for that let's start with the vegetables and fruits, because the thing is that we should begin all these things at our home itself.
definitely.
What do you think are the best food or the nutrients that we should intake for to protect our lungs and to keep them safe?
Lot of these citrus fruits, they give you a lot of vitamin C. I don't recommend anybody taking vitamin C tablets as recommended by most of the doctors,
Yeah,
but I
okay.
don't recommend them. Just take good citrus fruits. Seasonal fruits are there to provide you these nutrients, minerals. So citrus fruits, green leafy vegetables, lot of colored food into your that capsicum and all those salads. These dals, proteins, soya bean.
Right.
If anybody eats non-vegetarian food, eggs obviously, and then the roti should be of bajra, ragi, and all those old kind of thing. It should not be refined. Oil should not be refined, and plus lot of hydration. So
Yeah,
everything starts.
I was about to come on that also, hydration.
Everything starts from your kitchen. Everything goes back to the basics. If we are following those basics, we are healthy. If we are not, see, we are following that Singapore concept or Western concept of not cooking, not getting the food cooked at home, not getting the fresh vegetables. It's not going to help us because we are not in that situation. We are in a highly polluted area with high. What is the standard of a pizza being made in your society? There is no standard. I don't know what he is mixing in those, what kind of paneer he is using, what kind of spices he is using. So just avoid them.
And how connected is hydration and lung health? Why is drinking water so important, and how much water is required?
So 70% of your body is of water. So if you are not taking water, whole of your cellular metabolism is going for a jump. So you should be taking 2 to 3 liters, 4 liters of water every day. It should include everything is water. Drinking water is water, coconut water is water. If you are taking some juice, that is also water, but it should be a fresh juice, not the packaged one. So whatever you are taking as a fluid in the day, it's 2 to 3 liters. If your surgeon or physician has not recommended against it, you should be taking 2 to 3 liters or at least 4 liters of water.
So at least 4 liters of water is necessary to keep our lungs safe. Also, sir, regarding tests, as you said, when should a person go for all those tests? Apart from that, like the lung capacity test,
you can go for an annual checkup also. An adult can go for a PFT, which is pulmonary function test. It's a test of the lung capacity. It shows a lot of graphs, fancy
and
graphs.
How often should people get that?
At least an year. At least an year. So they should go to the nearest facility, take an appointment with a pulmonologist. He will advise a PFT and get it checked by the pulmonologist. Other very important test which can be taken up by smokers. If you have smoked more than 20 years, 20 pack years, 20 years, then you should go for an LDCT, which is low dose CT scan. It's available in high centers like Medanta, Gangaram and all those stuff. You can go there, get an appointment for LDCT or get it recommended by a pulmonologist that I have spoken for more than 20 years. I just want to see whether I am developing some cancer or not. They will advise it, and it's a most preliminary test for lung cancer.
Okay. And for people who cannot stay indoors or buy air purifiers or fully avoid pollution, what practical steps can they take to protect their lungs?
See, most important is you increase your lung capacity. I would keep yourself hydrated, and whenever you are in a very polluted area, use a good N95 mask for at least 1 or 2 hours in continuity. Then you take a break from that area, you move away from that area, take out that mask, breathe well, and then again wear that mask. That mask can be worn
so how much risk will this wearing masks?
It's not risky as such, but it's not practical also, because see, breathing against resistance is not for everybody's cup of tea. It causes a lot of fainting attacks, that nausea and all those stuff. So it's not everybody's cup of tea, but if you have to do it, if you have to pass through that area, you need to do it.
Okay, so now moving on to another segment where I'll be discussing a myth or a statement, and you'll have to decide if it's a myth or a fact.
Sure.
So many people think that vaping is a safe alternative to smoking. Is it true or not?
If smoking is walking towards death, vaping is running towards death. Okay. So vaping is an industry which is completely unregulated. What kind of ethers, what kind of chemicals they are using, we don't know. It's considered to be safe, so it is done much more frequently than smoking, and it's damaging the lungs much more than smoking can do.
Okay. And holding your breath increases lung capacity?
Yes,
as we discussed. People with lung conditions should avoid exercise?
No, not at all. A good exercise, but not on outdoors if the AQI is about 200, 300. Avoid it outside, but you can do a pranayama yoga inside your house.
Well, I guess all our questions were answered. Thank you, sir. Thank you so much.
Thanks a lot.
And for our viewers, well, air pollution might be invisible, but we can see that the impact is quite visible. And for that, we need to keep, a check on our lungs. Do the exercise as I did. Check out your lung capacity and do that 4 times a day and increase it with it. And not just that, take steps to protect yourself, to protect those around you, the children, if there are elderly at your home. And sir, thank you again for answering all our questions. And for our viewers, for more such interviews, stay tuned with India TV.